Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Types of vaginal fistula. We have ureterovaginal fistula, vesicovaginal fistula, and urethrovaginal fistula. So, first ureterovaginal fistula and urethrovaginal fistula. In ureterovaginal fistula and vesicovaginal fistula, first the patient presents with if the patient presents with constant dribbling of urine from the vagina with normal urination, that is ureterovaginal fistula. That is, there is normal urination, so the bladder is completely normal and there is a constant dribbling of urine. It is constant, so it is from ureter. So this is ureterovaginal fistula. Then second, constant dribbling of urine from vagina with no normal urination. There is no normal urination. That means there is an issue or there is a fistula in the urinary bladder. So it is vesicovaginal fistula. So constant dribbling of urine from vagina with no normal urination is vesicovaginal fistula. Then second, urethrovaginal fistula. If there is urethrovaginal fistula, then the patient complains with there is no constant dribbling of urine from vagina. At the time of urination, urine comes from vagina and urethra. If there is no constant dribbling of urine from vagina, this means that the sphincter, the problem is after the sphincter, after the urethral sphincter, right? So it is in the urethra, and at the time of urination, urine is coming from the vagina and urethra. So this is urethrovaginal fistula.
thank you and thank you for watching.